Hello, my name is Michelle Corpus. I am an MPH candidate at St. George's University School of Medicine, and I will be speaking about typhoid fever today. Some of the background of this disease is that it is caused by infection with a bacteria called Salmonella typhi. As you can see in this geographic distribution, it is prevalent mostly in the developing world, almost everywhere except for Northern America, Western Europe, Australia, and Japan. It affects 21.5 million people per year worldwide and causes about 200,000 deaths per year worldwide. Typhoid is a waterborne disease, so it's transmitted by drinking water that contains the bacteria, or eating food that has been prepared with infected water or has been washed with infected water. Some of the signs and symptoms of typhoid include high fever of 103 to 104 degrees Fahrenheit, weakness, stomach pain, headaches, and loss of appetite. Now, these first symptoms are also characteristic of malaria, which is relatively common in the developing world. But one symptom that will distinguish typhoid from malaria is that typhoid has a characteristic rose-colored bumpy rash that's associated with it that will help distinguish it from malaria. In order to acquire a certain diagnosis of typhoid, one must acquire a stool sample or a blood sample from the patient, and the bacteria can be visualized directly on either of these samples to acquire a certain diagnosis of typhoid. The people at the highest risk of developing typhoid, as seen here, are those who live in the developing world where sewer systems are not quite as developed, so there is a higher likelihood that sewage water will contaminate drinking water. So the people living in these developing communities are at highest risk for developing typhoid. However, people who travel to these developing countries are also at high risk for developing typhoid. There are approximately 6,000 cases of typhoid diagnosed in the United States every year, and well over 90% of those are due to people who have traveled to the developing world recently. So people who are traveling to those developing countries are at high risk. Some prevention strategies against acquiring typhoid are to boil it, peel it, cook it, or forget it. If you have water that you're not sure is clean, boil it at a rolling boil for at least 1 minute. If you're having produce from an area that you don't know is clean, peel it and discard the peelings. You can cook your food thoroughly and eat it hot to make sure that it doesn't have any bacteria in it. Or forget it. If you're not certain something's clean, just don't eat it and don't risk getting typhoid. There are also 2 forms of vaccinations that are available for typhoid. There is a course of 4 pills that can be taken over 2 days, and that vaccination is good for 6 years. And there is 1 injection that can also be taken, which is good for 2 years. Once one acquires typhoid, it is important that he or she practices proper hygiene, especially washing one's hands after going to the bathroom to make sure that they don't spread typhoid to other people. If someone suspects that they have typhoid, they should see a doctor immediately. And if you're traveling, the local consulate should have a list of recommended doctors. And since Salmonella typhi has become resistant to many antibiotics, the 2 that have been most effective in combating it are ceftriaxone and azithromycin. Hydration will also be encouraged to counteract the effects of the fever. If you'd like any more information on typhoid, there are 3 excellent resources here, including the Center for Disease Control and Prevention, the CDC, Mayo Clinic, and the World Health Organization. I hope this presentation has been informative, and thank you for your time.